Another set of tools for understanding healthcare is by using the ideas of systems theory. Essentially, systems theory sees organizations comprised of smaller units that must operate as a system together. These units work collaboratively and cooperatively in order to be effective. So, as before, when we were talking about communication within organizations on an interpersonal level, here we're looking at the way units within a system interact. So, there are several types of systems. Um, Systems theorists argue that organizations must operate as open systems so that they're interacting and communicating internally as well as externally. So, a closed system is one that's cut off from the outside world. These systems don't survive. Without input from external sources, systems can't sustain themselves. Anyone who was on lockdown and figured out you still needed food or toilet paper, those sorts of things, yeah, your system, if it was too closed, you weren't going to make it. You had to find ways of interacting and communicating with systems on the outside of your own. In contrast, open systems rely on the outside world as well as internal communication. They get supplies and information from outside and then make use of it inside. We can think of this in our hospital system there, where you have different organizations, different units with physicians, nurses interacting with the pharmacy, physical plant, or EMTs who are coming through. Again, we go back to this idea of hierarchy. Within organizations, you can have many subsystems, and these systems will most likely relate to one another in a hierarchical fashion. So, if you're a nurse, you might be part of the nursing staff. However, you are a nurse in the emergency department as well. And within that, you're reporting to general medicine um, and to the hospital administration and the hospital board, right? And the board may report to the state or medical board. All of this, in the case of the hospital, is our supra system, okay? The largest, the highest level. And then underneath, you can have your focal system. So your focal system might be the emergency department, if you're that nurse. And your subsystem might be the nursing staff of the emergency department. So the point is to think about each of these subsystems as open and linked to other systems. Communication is essential between the different parts of the suprasystem. But beyond that, we actually need to take it somewhere else because although we have that suprasystem, it exists within a larger context, the relevant environment. So when we're looking at a system, we're looking at that external world that affects what's going on for you. So, what might be the relevant environment for a hospital? Well, I need to be thinking about the population of that hospital, of the area around it. How healthy are the people there? Because that's going to matter in terms of the kinds of care that I need to have. Who are the staff I will need? What are the unemployment rates? How many uninsured patients are going to come to my hospital seeking treatment? What are those insurance reimbursement rates? Remember, we know that different hospitals have different rates, and so that actually is going to have an impact on how much you make, right? Um, National politics may be part of your relevant environment. If we think about the moment we're in right now, how much is the government going to be subsidizing you for vaccine distribution, for the procurement of vaccines? And what kind of support can you expect from the government to help out in this crisis? National politics are important, but state and local politics are important as well, because you get regulations that you have to follow. Another thing I might be thinking about would be local violence. Am I going to have people there who are trauma specialists, a lot of them because maybe there's a lot of gun violence? These are things that I have to think about in my staffing. It also will matter in terms of security at the hospital. I'm also going to need to be thinking about, are there local medical schools? Am I a teaching hospital? Will I have easy access to staff who can help me? Will I get good residents, medical experts? This will matter a lot. And then are there other hospitals in the area? The competition from them. If there are multiple hospitals, I may want to specialize. Even as we have these giant mergers of hospital organizations, we still see individual hospitals with specialization. You go to the Dana-Farber for cancer treatment. You don't go there for diabetes. So we can have this understanding of all of the different pieces in that relevant environment. Another thing I'm going to think about, drug prices as well. All of these are things I have to be considering when I'm running a hospital, when I'm operating within it. Another important thing for systems theory is permeability, which is the degree to which systems can operate effectively. It relies heavily on how much permeability there is between the systems. And so, how much information sharing do I have within the organization between these different departments? Is billing connected up with medical, with surgical, with laboratory? How are they communicating with each other? How well is information from the outside getting into my system? And how easily does information from the inside get out? Which is to say, are the boundaries between the departments and from the organization to the outside world permeable? Closed systems eventually become disabled because of disorder within the organization. The state of disorder in systems theory is referred to as entropy. What you want is not entropy, but you need that requisite variety. So this portion of the theory holds that within each of those subsystems, you have to have a degree of complexity so that they can respond to the variety of inputs received from other environments. So that there needs to be people within each of those who knows how to interact and understands what's going on in different departments. An organization with the proper amount of permeability and requisite variety within them can achieve homeostasis, balance. And that's what you're looking for in an organization. The last term I want you to think about is equifinality. And this is sort of in opposition to classical management theorists. It's the principle that there are multiple ways to achieve the same outcome. So we are currently in a budget crisis. And as we think about things, if our goal is to reduce the deficit, there are multiple ways to get there. Some people will argue you can do it through budget cuts. Others will say, no, actually, what you need to do is increase revenue, so taxes. Others might say, actually, it's a combination of both. Equifinality asserts that there's no one correct way to achieve your goals. For a hospital in a budget crisis, they could address the budget shortfall by laying off workers, by seeking out new patients, elective surgeries, partnering with other institutions, raising costs, focusing on preventative care, or some combination of these. One of the reasons that hospitals are struggling at the moment in coronavirus is that, in addition to all of the stress that this causes for personnel, the budget themselves, hospitals are hurting. Medical practices in general are hurting because people are holding off on going to their doctors. And when they don't go to their doctors, they don't get paid. And additionally, you have hospitals, you have so many people opting not to have elective surgery or even necessary surgeries that are not connected to COVID. The result is that income is down for hospitals. So at the very point that they need to be running at their greatest efficiency and their greatest levels, they have the fewest resources to accomplish that.